Hey everyone, and welcome back to the channel. Today, we're diving deep into a topic that so many of you have asked about: cystic acne. If you've ever dealt with those deep, painful, under-the-skin bumps that seem to last forever, you know how frustrating and confidence-draining they can be. But here's the good news: you are not alone, and there are effective ways to manage and treat it. In this video, I'm going to unlock the secrets to tackling cystic acne, sharing expert tips and a comprehensive guide to help you get your skin back on track. We'll cover everything from what causes it to the best treatments, lifestyle changes, and what you can do right now to start seeing a difference. So, grab a notepad, get comfortable, and let's get started on your journey to clearer skin. First things first, what exactly is cystic acne? Unlike your typical whitehead or blackhead, cystic acne is the most severe form of acne. It happens when a pore gets clogged with dead skin cells and oil, but the infection goes deep into your skin, creating a tender, fluid-filled cyst. These aren't just surface-level pimples. They form in the deeper layers of the dermis. This is why they're so painful, take weeks or even months to go away, and are more likely to leave behind scars if not treated properly. Understanding this is key because it means our approach has to be different. We can't just slap on a spot treatment and hope for the best. We need to tackle it from the inside out and the outside in. So, what triggers these painful cysts? The primary culprits are hormones, specifically androgens. These hormones can overstimulate your oil glands, leading to excess oil production that clogs your pores. This is why cystic acne often flares up during puberty, menstruation, pregnancy, or periods of high stress. Genetics also play a huge role. If your parents had severe acne, you're more likely to experience it too. And let's not forget about lifestyle factors. Things like diet, stress levels, and your skincare routine can all contribute to the problem. It's a complex puzzle, but by understanding the pieces, we can start to put together an effective strategy. It's not about blaming yourself, it's about empowering yourself with knowledge. Now, let's talk about treatment. Because cystic acne is so deep, over-the-counter products often aren't strong enough to make a significant difference on their own. This is where a dermatologist becomes your best friend. A professional can provide a proper diagnosis and create a personalized treatment plan for you. One of the most common and effective treatments they might prescribe is oral medication. Things like oral antibiotics can help reduce bacteria and fight inflammation. For women, hormonal birth control pills or spironolactone can be game changers because they help regulate the hormones that trigger breakouts in the first place. These treatments work from the inside to calm things down, which is essential for cystic acne. Another powerful oral medication your dermatologist might consider is isotretinoin, commonly known by brand names like Accutane. This is a form of vitamin A, and it's often considered a last resort for severe, persistent cystic acne that hasn't responded to other treatments. It works by dramatically reducing the size of your oil glands, which in turn cuts down oil production. It's incredibly effective, and for many people, it can lead to long-term remission from acne. However, it's a serious medication with potential side effects, so it requires close monitoring by your doctor, including regular checkups and blood tests. It's a significant commitment, but for those who have struggled for years, the results can be life-changing. Always have an open and honest conversation with your doctor about the pros and cons to see if it's the right path for you. What about topical treatments? While they might not clear cystic acne on their own, they are a crucial part of your support system. Your dermatologist will likely prescribe a medical-grade topical retinoid like tretinoin. Retinoids are superstars when it comes to skin cell turnover. They help prevent your pores from getting clogged in the first place and can also help with the scarring and hyperpigmentation that cystic acne leaves behind. It's important to introduce retinoids slowly into your routine, maybe just a few nights a week at first, because they can be irritating. And always wear sunscreen during the day, as retinoids make your skin more sensitive to the sun. Patience is key here. It can take a few months to see the full benefits. Let's discuss some inner-fist procedures that can provide immediate relief and long-term benefits. If you have a particularly large, painful cyst that just won't go away, your dermatologist can perform a cortisone injection. A diluted corticosteroid is injected directly into the cyst, which dramatically reduces inflammation, swelling, and pain within 24 to 48 hours. This is a fantastic option for a quick fix, especially if you have a big event coming up or are in a lot of pain. It also helps reduce the risk of scarring because it prevents the cyst from getting larger and potentially rupturing. Never ever try to pop or drain a cyst yourself. This will only push the infection deeper, worsen inflammation, and almost guarantee a scar. Leave it to the professionals. Now, let's move on to lifestyle changes, because how you live your life has a huge impact on your skin. First up is diet. While the link between diet and acne is still being researched, many experts and individuals notice a connection. High glycemic foods, which are foods that spike your blood sugar quickly, like white bread. Sugary snacks and sodas have been linked to increased inflammation and acne flaps. Some people also find that dairy, particularly skim milk, can be a trigger. My advice: try keeping a food diary for a few weeks. See if you notice a pattern between what you eat and when your skin flares up. You don't need to cut out entire food groups forever, but being mindful and perhaps reducing your intake of potential triggers can make a real difference. Focus on a whole foods diet rich in antioxidants, like fruits, vegetables, and lean proteins. Next, let's tackle stress. When you're stressed, your body produces more cortisol, a stress hormone that can throw your other hormones out of whack and increase oil production. It's a vicious cycle. You're stressed about your acne, which makes your acne worse, which makes you more stressed. Breaking this cycle is crucial. Find healthy ways to manage your stress. This could be anything from daily exercise, meditation, yoga, or even just taking 15 minutes a day to do something you love, like reading a book or listening to music. Getting enough sleep is also non-negotiable. Your body repairs itself while you sleep, and a lack of it can lead to more inflammation and stress. Aim for 7 to 9 hours of quality sleep per night. Your skin will thank you. Let's build the perfect skincare routine to support your treatment. When you're dealing with cystic acne and using strong treatments, your skin barrier can become compromised and sensitive. The goal is gentle support, not harsh scrubbing. Start with a gentle, non-foaming, pH-balanced cleanser. Avoid anything with harsh sulfates or physical scrubs that can irritate your skin. In the morning after cleansing, you can use a hydrating serum with ingredients like hyaluronic acid or niacinamide. Niacinamide is fantastic because it helps with inflammation, redness, and oil regulation. Then follow up with a simple, non-comedogenic moisturizer to lock in hydration. And the most important step, a broad-spectrum sunscreen with at least SPF 30 every single day, no exceptions. Your evening routine will be similar, but this is where you'll incorporate your prescribed topical treatment like a retinoid. After cleansing, wait for your skin to be completely dry. This is important to minimize irritation. Apply a pea-sized amount of your retinoid for your entire face, avoiding the delicate eye area. Then, follow up with your moisturizer. Some people like to use the sandwich method, where they apply a layer of moisturizer, then the retinoid, then another layer of moisturizer. This can be a great way to buffer the treatment and reduce dryness, especially when you're just starting out. The key is to keep it simple. Don't overload your skin with a dozen different active ingredients. Stick to the plan your dermatologist gives you and be consistent. Finally, I want to talk about the mental and emotional side of cystic acne. It's so much more than just a skin condition. It can deeply affect your self-esteem and mental health. It's okay to feel sad, frustrated, or angry. Your feelings are valid. Please know that your worth is not defined by your skin. You are more than your acne. If you're struggling, don't be afraid to talk to someone, a friend, a family member, or a mental health professional. Sometimes, just sharing what you're going through can lift a huge weight off your shoulders. Remember that you are on a journey, and there will be good days and bad days. Celebrate the small victories, be patient with the process, and most importantly, be kind to yourself. You are doing the best you can, and that is enough. Thank you so much for watching today. I hope these tips have given you a clearer path forward and a renewed sense of hope. Managing cystic acne is a marathon, not a sprint. But with the right knowledge, professional guidance, and a lot of self-compassion, you can and will see improvement. If you found this video helpful, please give it a thumbs up and subscribe to the channel for more skincare advice. And don't forget to share your own experiences or questions in the comments below. Let us support each other in this community. Thanks again, and I'll see you in the next video.